Parkland Cancer Center offers comprehensive cancer care close to home. Both Parkland Health Center and Missouri Baptist Medical Center are members of the BJC healthcare system with access to world-class care. Did you know the same cancer center physicians that you would see at Missouri Baptist Medical Center are the same cancer physicians that you will see at Parkland Cancer Center in Bonne Terre? This means less travel time and more time at home, which is important, especially when you're not feeling well. When a new patient comes to Parkland Cancer Center, they're seen by one of our oncology physicians. The oncology physician discusses a treatment plan with them. They also see an oncology certified nurse who helps them understand what that treatment is going to entail. For instance, how many days they're going to have to come for treatment, how long those treatments are going to last. That day they are usually at least introduced to the social worker where she can assess their stress level, what sort of needs they may have, whether those would be financial assistance or maybe financial assistance with their drugs, family situations. Sometimes people need help with transportation, getting back and forth to the clinic. She can also help with that. We like to bring that patient down to the treatment room. Even if they're not going to receive their first treatment that day, we like to bring them down to the treatment room, let them meet the staff, kind of see what the environment is like, where their treatments are going to take place. Sometimes we will even begin their chemotherapy education that day to give them an overview of what cancer is, how chemotherapy works. We go over the individual drugs that they're going to be receiving, the potential side effects, and even more importantly, how we're going to help them manage those side effects. We try to include their family in the process. We actually encourage family involvement. We encourage family involvement when they're actually getting their treatments. It's usually a lot more pleasant for the patient if they can have someone familiar with them, whether it be a friend or a family member. We try to provide a calm, compassionate, informative atmosphere. I think the rest of my colleagues feel like this too, that anxiety can be lessened through education. So we try to tell that patient what's going to happen to them before we do it, what they can expect, how to contact us for help if they do run into issues at home, because typically the side effects from chemotherapy are not seen during the infusion. They're not seen inside the clinic. One of the advantages to having cancer care so close to home is that, typically when someone is going through chemotherapy, there's a lot of fatigue involved. So, even adding an hour onto that person's day in driving time, that may not be significant to you or I, it's significant to them. So having that comprehensive cancer care close to home is really nice. The most important thing that I try to make sure my patients understand whenever I get a new patient, and I'm doing that initial education, we're doing that first chemotherapy treatment. I try to get them to understand that, no matter what you're going through, no matter how insignificant you think your feelings may be or how insignificant that side effect may be, there's nothing that's too insignificant for a phone call. And there's always someone available. You're not alone. We're here to help you. We're not here just to treat your cancer. We're here to treat you, the person. That's the most important thing, I think.